Hi, I'm Dr. Claudia Kim. I'm a cosmetic surgeon here at New Look New Life. Today, we're going to talk about arms. Everyone, especially with the warmer season coming up, may feel a little self-conscious about a little bit of fullness or some skin looseness in the arm area or the underarm area. And I always see women commonly doing the shake and kind of showing off their bat wing. So we'll talk about the different modalities and procedures that we can do to address the arms. So first, I want to talk about liposuction for the arm. If you do have a little bit of extra fluff or fat, you can use liposuction to suck out that area to kind of contour the shape of the arms. If you have a little bit of skin laxity, remember liposuction will remove the fat and can potentially tighten up the skin a little bit. And depending on the person, depending on their age, depending on the amount of fat and the quality of the skin, you may get a varying result in terms of skin contraction. But a good way to assess if you are a good candidate for just straight liposuction, if you are young and you're looking at the skin quality of your arms and you don't really have that much stretch mark, then liposuction might be adequate to kind of reduce and contour the shape of the arm. Stretch marks are an indicator of the skin having been broken. So when that first few layers of the skin kind of stretches out, then you have what is stretch mark. And so someone who has had a significant weight fluctuation or change in the size of the arms, you may have those stretch marks. And that tells me that the skin has been broken. It may not tighten as much compared to someone who doesn't have any stretch marks. Now, the next thing I'm going to talk about is if you do have a little bit of extra loose skin, we can combine liposuction with the Renuvion J plasma system. The Renuvion system is actually using heat energy to cause a traumatic inflammation. And so as the body heals that inflammation, it can help to stimulate collagen and to tighten up the skin. So again, if you have a little bit of extra loose skin, then the Renuvion system can help to contract the skin up to about 50%. Now, what if you do have a significant amount of skin and not much fat? Let's say you lost the fat on your own personal journey, either with diet or exercise or using the semaglutides or the GLP-1 agonist, then you may have already lost the fat but left with a little residual skin. So next I'm going to talk about an arm lift or brachioplasty, which essentially means that it is cutting out the loose skin. Some individuals, if you do have the component of loose skin and extra fat, we can combine liposuction at the same time as an arm lift. So with an arm lift, you are removing skin. So there is unavoidable scar. And the most common thing that I get asked is how big the scar is going to be. So that really depends on how much loose skin you have. And so a good exercise you can do is kind of lift out your arms in the mirror and you see where the skin starts to sag downward. And so that's going to tell you the extent of the scar. So yes, the scar is unavoidable and it can be visible in certain areas. And also depending on how much loose skin you have will determine the size of the scar. So let's say you just have a little bit of loose skin right at the armpit area. Then you can do a short scar brachioplasty, which means that the scar is right in the armpit. But the smaller the scar is, the less skin you're able to remove. So always remember you're trading off skin tightening for the size of the scar. So for a short scar brachioplasty, because you're only making an incision in the armpit, you're only going to get a few inches of skin tightening, and it's only going to be from maybe the middle of the arm down to the armpit. A standard brachioplasty, so when you're doing that little exercise and you see the skin starting to sag down from the elbow, that's where the start of the scar will be. It's going to be from the elbow into the armpit. Now, if you look at the skin on the armpit area or the side of the chest, then your scar will extend into the armpit down to the side of the breast or the side of the chest. A lot of individuals who have gone a significant amount of weight loss will notice that they will have some ptosis or some sagging of the breast or deflation of the breast, or let's say, you've had children or you've had pregnancies in the past and you have sagging of the breast and you want to address the arms at the same time. In that situation, we can actually combine the brachioplasty with the breast procedure. And if you have that extra loose skin on the side of the ribs here, that scar will extend down from the elbow into the armpit, down to the side of the breast and actually connect with the breast lift scars. So it really depends on what you're trying to improve, what your current state or body composition is, and what you want to address at the same time. But in regards to visibility of the scar will be right where that little groove is between your bone and your muscle area. It's called the bicipital groove. And that scar won't be visible unless you're walking around like this. Now, how many people actually walk around like this? So when you're putting your arms down, it may be slightly visible from the elbow, from the back side. But when you put your arms down and your people are seeing you from the front, you really won't see the scars. One thing to note is that when you put a scar in an area that moves a lot, right? So you're always going to be moving your arms. That area tends to be under a lot of tension. And when there is tension on the wound, it tends to widen the scar or tries to stretch out the scar. So patients really do need to be aware of that the scar may not be as pretty in the armpit area, and it might be nice and thin around the elbow or down the sides, but the armpit is notorious for having widening of the scar. Now, other consideration when it comes to scar, everyone scars differently. Some individuals will scar into a light pink or a white scar. Some individuals scar into like a dark brown scar, especially my melanated people, right? So when you are considering a skin excision procedure, you really need to examine other scars that you have on your body, let's say from other surgeries, C-sections, etc. And you have to accept the fact that, is that color of scar acceptable to me to be on the arms, which can be visible when I raise my arms, right? So everyone heals differently. There are some products that we use in all my surgical patients, such as silicone scar tape, sunscreen, that can help to improve the quality of the scars. And for some individuals, they form keloids or hypertrophic scarring, where the scar gets thick and almost like a mushroom from the scar. If that's something that you have dealt with or you know that you have an issue with, then maybe a scar that is in a visible place may not be acceptable for you. Take into consideration that if you have a significant amount of scar, is that scar going to be worth it to have better contoured arms? One common thing that I hear a lot of patients who have had a brachioplasty done by a previous surgeon is everyone always says that I wish they took out more skin. One thing to always remember is that during the surgery, either from just the surgery itself or from local anesthesia or from liposuction being done at the same time as an R-lip, you're going to have a lot of swelling. And so when the surgeon is estimating the amount of skin that they're going to take, we always take into consideration the amount of tension. There's too much tension on the skin edges when it's coming together. It's going to put more stress on the scar and eventually cause a higher risk of the wound falling apart. So when the skin is being estimated, that's the amount of skin that they reduce at the time of surgery. So in the beginning, because of the swelling, it is tight, but as the swelling starts to go away in your post-recovery period, that skin starts to soften and you'll notice that it becomes a little bit looser. So I think it's very important for surgeons to make patients aware that you have to take out enough skin but be able to close in the safest manner possible to reduce the amount of complications. When after the healing period, you still have some loose skin, you can always go back and take out more skin, but you can't put back skin. So it's always important to be able to remove a safe amount of skin so that you don't have wound complications. So I always remember to tell my patients this so that they are aware and they are mentally prepared. Now, another thing in regards to patients who are on their weight loss journey. So before you do any body contouring procedures or skin removal procedures, you have to make sure that you've been at a stable weight for at least 6 months. So congratulations, you lost all this weight, but we have to really see that you are maintaining that weight because we're doing the surgery to address whatever issues that you have at that point in time. But if you end up losing more weight, then that changes the way that your body is, and you may need potential revision surgeries in the future. Now, what to expect after surgery for the arms? So if it is just liposuction, remember you will have swelling, you will have some drainage. I generally tend not to leave drains when I do liposuction for the arms, but you may get some draining of that local anesthetic fluid and that fluid that we use during liposuction. Usually the drainage will stop after about 48 hours. Okay. And the bruising can last up to 2 to 3 weeks, and the swelling can last for about 6 months. So immediately after the procedure, you are expected to wear some type of compression garment, and the compression garment really needs to extend past your elbow, at least down to your forearm. And that compression garment needs to be worn for at least a month, 24 hours a day, 7 days a week. Now, some individuals may experience some swelling all the way down, because remember, when you're walking around, your hands are dangling by their side. So that swelling kind of falls down because of gravity, and people may experience some swelling in the hands or swelling in the forearm area. In that situation, you can extend some kind of compression garment down to your hand. It's most prominent in the first few days after liposuction and will start to improve after a week or so. But the compression, like an ace bandage, can help to reduce some of the swelling in the hands. Or when you're home and relaxing, make sure to prop up your hands with a couple of pillows above the level of the heart so that the swelling can actually drain downward. For the recovery expectations for an arm lift, so this surgery is a little bit more extensive. Again, you may have that swelling and that bruising. The bruising can last up to 2 to 3 weeks, more in some individuals that are prone to a significant amount of bruising, and that same swelling that we see in liposuction. So other things to note after an arm lift is that you do have to wear the compression garment longer. So I do recommend wearing the compression garment up to 2 months, especially because you may have more swelling. So you do need that compression to kind of keep things nice and tight to reduce the amount of swelling. But you can do the same arm elevation or the compression on the hand and the forearm to help with the swelling process. The other restriction that you have is that you are not able to raise your arms above shoulder height. So no jumping jacks, no exercise, and no heavy lifting for at least 4 weeks. And the reason for that is the incision, if it's going to cross across the armpit, you don't want to create that extra movement to create that tension and that stress on the incision to really minimize the amount of stretching that we commonly see in the armpit. The other restriction is that you cannot submerge yourself underwater, either at a pool, a beach, or a bath for at least 3 weeks, because the incision is a large incision. So you don't want to introduce any foreign bacteria or any issues that might potentially cause a problem. Other risks and complications of a brachioplasty is, we talked about one of them, is the pore scarring and the visibility of scars, right? Swelling, bruising. One thing to note is that you may have numbness of the upper arm. So there is an important nerve that provides sensation to this area here. And so if you do have disruption of that nerve, you can potentially have numbness of the arm here. So most surgeons who are familiar with anatomy will be careful to preserve that nerve, but you may have some numbness along the incision for even up to 2 to 3 weeks. That's very common. And most individuals will start to report the pinching or the tingling or the pins and needles on the arm area at about the 2 to 3 weeks, because the fine sensory nerves start to wake up. And so as the nerves wake up, it presents as the itching and the annoying tingles. But if you do have disruption of that main important nerve, you may have numbness of that entire arm area for a permanent time. Another thing that you cannot do is wear the deodorant for at least 3 weeks and no lotion to the incisions for 3 weeks. So if you know that you are a heavy sweater, then maybe the summertime may not be the best time for you to have surgery. And also with wearing the compression garment is going to go past that elbow. And the compression garment that we have or we utilize is a bolero. So it has that arm component and it can go across your chest with or without a bra. So remember, for an arm lift, you're wearing this for 2 months. For liposuction, you're wearing this for 1 month. So it can get a little uncomfortable, especially in the heat of the summer. So I hope you guys learned about the procedures that we do for the arms. Stay tuned for other videos like this.